Okay, so this is introduction to the nursing process. Everything that we do in nursing goes through what we call ADPI. That's the nursing process, and this is what it looks like. Assessment, diagnosis, planning, intervention, implementation, and evaluation. Let's fix this. Okay. And then that's what we do. Everything that we do, every patient that we encounter, every client that we see, we're using the nursing process to make sure that they're getting the best possible care. Okay. Very important. And you will understand why when I'm done with you. So, what's the goal? The goal is to help individuals meet their basic and higher level needs. And the nursing process helps get us to specific interactions, right? And how we provide care to people. So we encourage others to be healthier, and we also solve health problems. We work with doctors and other members of the team to work together to use scientific solving skills along with critical thinking skills to try to figure out what's wrong, what could go wrong, and what can we do to fix it or prevent it. That's everything that we do. So what's problem solving? It's the skill of identifying a problem and then taking steps, methodical, scientifically based steps to resolve it. We use an experimental approach that tests ideas, and that's how we decide what things work and what things don't work. And this is what we use for evidence-based practice. You're going to hear me say that term a lot. That means that everything that we do, whether it's a hands-on skill or, whether it's medication administration, we look to evidence-based practice to determine if we're doing it the right way or the way that the community has found works. Okay. It's based on empirical scientific data. So, problem solving, please know these steps to problem solving. So, first, you have to identify the problem. Then you have to gather information that's relative to the problem, but it's got to be from a credible source, not Google. Google is a library. Google will give you a bunch of responses to whatever you put in that search bar, but it doesn't mean that the first one that pops up is actually a credible source. So you have to learn to know what sources are credible and what sources are not. Well, then when we've gathered information, the next thing we do is we try to figure out tentative solutions, potential solutions, which are called hypotheses. And then we figure out which one is the best one. We choose a solution. Then we make a plan to implement that solution. We look at the results, draw conclusions, see what it means, and then we evaluate. Did it work? Right? Or do we have to start from scratch and do it again because the results aren't what we were hoping they would be? Okay. That's the way we solve problems scientifically. So, critical thinking, you're going to hear me say this a lot too. Critical thinking, I love this definition. It's grasping the meaning of multiple clues and finding quick answers when you're facing difficult problems. In order to be a critical thinker, you have to be open-minded. In other words, you have to, understand that maybe what you think the right way is may not be the right way and be open to listening to other ways of doing things. You have to be fair-minded. You have to always search for credible evidence. You have to be relevant, well informed. You have to listen to other people's views and their reasons. And you always proportion your belief to whatever the evidence is to support it. Okay. And always be open minded and willing to consider alternatives and maybe change the way you think. Okay. Critical thinking helps us think like a detective so we can gather information, kind of categorize it, and then solve the problem. Right. So the nursing process combines critical thinking skills with problem solving methods to identify problems with clients and then provide care in a way that's structured, purposeful, and effective. Okay. So the method that directs the nurse and client together determine the need for the care, plan and implement the care, and then evaluate. Did it work? And you're going to use this framework, we call it, throughout your nursing practice for the rest of your career. Okay. You use it to identify problems, treat problems, and even prevent problems. Okay. Nursing care plans, critical pathways, concept mapping, clinical pathways. These are all written versions of that process of identifying a problem, coming up with some kind of a diagnosis and then a possible solution, implementing it and evaluating it. Okay. So the care plan enables you to figure out if what you did for your patient helped. There can also be possible needs or potential problems, like maybe somebody's at risk for developing compromised skin integrity. So, what can you do to not let that happen? And then once you do this for a while, it's just going to become your way of thinking and it's automatic. You won't even have to really give it much thought. And just so you know, a critical pathway is a pre-made care plan for things that we commonly see, common illnesses and procedures, like an appendectomy or a cholecystectomy, gallbladder removal, right? And, it goes through and says, all right, well, here are the potential problems that the patient may have, like postoperatively. Here are the evidence-driven interventions that you should try to implement. And then you evaluate and say, did it work? Or did something go wrong? Did the patient develop an infection or something? Right? Is the following statement true or false? The nursing process highlights the differences in roles between licensed and non-licensed personnel. What do you think? If you said true, you'd be right. So this is what's important. Unlicensed personnel required to know how to take vital signs. But as a licensed nurse, we have to know why the vital signs are important and what the numbers that we get from those vital signs, what they mean regarding the condition of our client, right? So that's the difference. Unlicensed personnel perform tasks. We use critical thinking, clinical judgment, right, in order to figure out what's wrong with our clients. And there's a nursing process again. So we work with the client. The client has to be an active participant in his or her plan of care. Remember, that's the nursing ethical principle of autonomy. So, and you're constantly reassessing what's going on with your care plan. Is it working? Do we have to revise it? Right? Or is it not working? What's going on? How are we doing? Are we successful? So this is a great little table. The scientific problem solving steps versus the nursing process. So gathering information, well, that's your nursing assessment. Identifying a problem, that's your nursing diagnosis. Formulating solutions, coming up with solutions that are the best ones, that's your planning. Testing the solutions, implementation, implementing the interventions. Evaluate the results, well, you're going to evaluate. And then revise as needed. There you go. So they are kind of one and the same. Okay. So, what are the characteristics of the nursing process? You should know this stuff. Okay. You see it's highlighted, know it. The nursing process is systematic, it follows a specific, orderly, and logical manner of steps that's based on the client's vital needs. And it entails you prioritizing what's the most important and the least important. The nursing process is always client focused. So we're identifying what the needs of the client are and focusing on meeting those specific individualized needs. Always goal oriented, measurable. Okay. Your goals, objectives, or expected outcomes, what you hope will happen or hope won't happen, have to be measurable. So if you hope that the patient will not develop compromised skin integrity, then you have to attach a time frame to it. Say within 48 hours. For the next 48 hours, their skin will remain intact. It's a measurable goal. And then it's continuous, the nursing process. You're always reassessing. Patients change, things change. You have to revise your care plan and, as needed to make sure that the patient's getting the best care. It's also dynamic, which means it's always evolving, right? And you can work with a lot of clients who all may have the same problem, but the care plans are going to differ a little bit because they should be individualized for each client to make sure that every person is getting the best possible care that you can provide. Okay? So, another question. Which step of the nursing process allows nurses to identify priorities and collect data? Collection of data, information. If you said nursing assessment, you would be correct. That's where we go in, we collect data, information, right? That's the assessment portion of the program. And then we can move on to figure out what that patient needs. Okay. So that's the nursing process. And we're going to talk about care planning next, and that's fun. So until the next video, peace.